Okay. Good morning. This is a presentation for the Vail community, the realtors in particular. We are Alpine Association Benefits. My name is Brady Mullen. You've probably seen or heard us around. We've been around for a couple of years working with CAR on providing healthcare solutions for realtors. And I think you're really going to like what we've been working on lately. It opens things up very well, especially in the Vail community and communities like it where medical care is a little bit tougher to get and to organize and to pay for. So this is a major upgrade in a couple of ways. We also are now offering services for traditional insurance. We have some great resources there. We'll talk about that. Our relationship with CAR is we're independent. We're working with CAR. We work on a contract with them to help provide viable healthcare options for realtors. So we're going to be talking about insurance solutions and some different insurance carriers, and also Redirect and Sedera. And it's important to know that we don't work for any of them. We vet them. We discuss their benefits, how they work together, how they can provide benefits to realtors. We work on that with CAR, and then work on the technology to make that available to realtors. And we think we have some pretty neat stuff for you to consider today. So let's dive into this. The benefits that we've been working on, we're going to talk about eligibility, who can use these. So first, this is available for Colorado realtors and their spouses and dependent children. This, I always mention here that the realtor, him or herself, does not need to use these benefits for the spouses and dependent children to use them. So if what we're talking about today, if it doesn't work for the realtor individually, but it works for the rest of the family, then you can do that. As long as there's a realtor in the family, then you can use these resources that we're discussing today. Realtor assistants and staff can also use these resources. And then affiliate members. So think about independent loan officers, inspectors, appraisers. You have a lot of people in your industry that work as independent contractors. And as long as they're an affiliate member of either the local Vail Association or another local association in the state, or at the CAR level, they can also use these resources. Okay, so on our website, if you go to CAR's website, which is coloradorealtors.com that's their website.com, and then /healthcare, that will take you to these options. I'm not a techie, so I don't understand why this is, but I know that it doesn't work if you don't use the www. I need to ask that question so I can give a more an answer that doesn't make me look so much like an idiot, but the www needs to be there. But if you go to this website, it's a subdomain under CAR's website. It will take you to the health care options. And now we diverge onto the paths diverge into two options. There's a medical cost sharing solution. We'll talk about how that works. And then a traditional health insurance solution. We will talk about how that works, but not as much detail because this is something most people are familiar with. I will show you those resources and how to navigate them a little bit, but it's something that you've seen before. It's not new. It looks very similar to the Colorado Exchange. In fact, many of the plans that are available to you are the same plans that are available on the Colorado Exchange. There's a lot of limit of what we can provide as far as benefits go from the traditional insurance perspective. The state of Colorado has not yet allowed association health plans. We're keeping our eye on that very closely, and when that happens, we will be working with insurers to provide association health plans. But at this point, it doesn't exist. They will still be significantly more expensive than the cost sharing, but they might be less expensive than what you might get by going through a traditional route. But there are some options here that are not available on the exchange, and some that are. The advantage is that you also have a resource that works with realtors. One of us at Alpine, her name is Rita. She's been doing insurance in Colorado for 25 years. So she's very, very capable and equipped to help people navigate that if they run into any questions or if they would like some help doing that. So I'm going to show you really quickly. We're going to go over the differences between these two strategies from a high level, and then we'll dig into the resources themselves. Okay, so we're going to first talk about the differences between the two strategies from a funding perspective. So from the perspective of how does the money flow between the insurance company and the carrier, or the insurance companies and the medical providers and you, the patient, we're going to talk about those real quick and compare them side by side. So medical cost sharing, I abbreviate this term. It stands for virtual direct primary care, which is basically the concierge services that you may have heard people talking about. This is becoming a very popular service that people pay for, where you have 24/7 access to a doctor that can prescribe things, that can follow up with biopsies and labs, and follow through a care plan with you. And instead of paying for the services one by one, you pay a monthly subscription, and you have unlimited access to those resources. There was something I was going to say about that. I can't remember what it was. It'll come up. So if you combine direct primary care, and this stands for virtual direct primary care because it's done through like video conferencing and whatnot, with medical cost sharing, it's a very seamless and comprehensive solution. And we're going to compare that to traditional health insurance. So from a funding perspective, the philosophy behind medical cost sharing is, hey, small medical needs, I'm going to pay for myself as a member. Large medical needs, that's when I might need some help. So I'm going to turn to the community for those kinds of expenses. Now, I know that the terms small and large are a little bit subjective, and we'll talk about what that means. But as a little preview to what that means, that the number that determines whether something is large or small is up to you, with limits, right? So the lowest you could say that, hey, I want everything under $500 to be a small medical need, and if my medical needs surpass $500, then I want the community involved. Or you can make that number as high as 5,000. So it's up to you to determine whether a small medical need is anything under 500 or 5,000 or something in between. But that's up to you. But it's very simple and very straightforward. Small medical needs, I'll pay for myself. I'm a cash pay patient. I go to the doctor. They want $125. I'm not worried about that. I can pay that myself. It's when the costs are $5,000, $10,000, $30,000, $100,000. That's when I would like some help. That's when I'd like some big guns. So that's the philosophy there. Whereas in traditional insurance, they set up copay formulas. For primary doctors, it might be one copay. A specialist might be a different one. Labs, imaging, prescriptions, etc. You've got a copay until you meet annual deductibles that reset annually, and then you have coinsurance after you meet your deductible until you reach a max out of pocket, and those things reset annually. A little more complicated, but a different way of dealing with it. The monthly cost using this strategy is relatively low. We'll do some comparisons, but in many cases, it's like half or less than half of the monthly cost of getting traditional insurance. And the cost of traditional insurance is, as we all know, very high. Okay, that's it from a funding perspective. That's how it works, how the money flows back and forth when something happens. Now let's talk about administrative differences. Again, I'm going to remind people, because we've had a lot of people join since we started. If you have a question, we have enough of us that I'm muting everybody. If you have a question, throw it up in the chat feature, and I will glance over at that occasionally on another screen that I have. And I also have Stephen with me, who works with us, that will be trying to answer questions on the chat feature as we go. Okay, from an administrative perspective, here are the differences. So the entry point into the medical arena is done through a phone call or a video conference when you use VDPC. So if I've got something that's not an emergency, most of the things we're going to be talking about today, by the way, are non-emergencies. If you have an emergency, you go to the hospital, that would clearly be an instance where you're, well, in most cases, I guess, where the cost of doing that would be considered a large medical cost, depending on how you set that up when you enroll. But in an emergency, you go get the care that you need, and then we work out the funding afterward, and we provide funding and pay the bills based on the benefits. But in anything except an emergency, so if you've got a wrist that hurts or a shoulder that hurts, or you've got a cough that's not going away, the entry point into the medical community is a phone call or a video call with the VDPC. And from that point, it's sort of a triage system where if they can resolve it over the phone with the doctors that they have on their staff, that's great. I mentioned here that this is not telemedicine because it's like telemedicine, but on steroids. So not only can they prescribe things that are simple, like antibiotics for a sinus infection, but they can also order biopsies and labs and follow up with you in a week and talk through that with you. It's much more involved than telemedicine. Telemedicine's great, but it's only great for very small and superficial medical needs. You can go a lot deeper with VDPC doctors, and they can follow up, look at medical records, compare biopsies, see how things change over time, and stay involved with you over a longer period of time and get deeper in when that's required. So our entry point into the medical community is a phone call or a video call, and 80% of the time, the redirect, which is the company we're using to do this, they can resolve that over the phone or the video call. And then 20% of the time, they will coordinate an appointment for you, either with a doctor or the hospital or a chiropractor or a specialist in the area. And then, so 20% of the time, they will coordinate that for you. Traditional health insurance, your entry point is an appointment usually, or you go into an urgent care, a physical meeting. You go somewhere, you set an appointment, or you wait in line to be seen by a doctor. The nice thing about this is this costs money, and this does not. As long as you're a member, anything that can be resolved through VDPC doesn't cost you any extra money, and it's available 24/7. So you could do this, you could wake up at 2 a.m. not feeling well and call the VDPC, and they can prescribe things. You can go and get something from a 24-hour Walgreens at 3 a.m. And all of that is available 24/7 any day of the year. Whereas here, it's tough. If you need something during a time when most places are closed, sometimes your only option is the emergency room, and all of a sudden you've got a very big bill on your hand just because you needed some help. Even though it was simple, you needed it quickly. Much better way to deal with things for minor stuff that aren't emergencies. Another thing from an administrative perspective is when you use VDPC and medical cost sharing, there are no network considerations. You don't have to worry about networks at all, which is a major upgrade. If you saw some of the things we were doing through Apex and Sedera before, which is great, and that option is still working for a lot of people, but in the mountain communities, it's tough because the minor medical things or the preventative medical things that people are using Apex for, you still had to use a network. Well, using this change that we're rolling to now has no network considerations at all. So you get the care that you need without any network considerations. And of course, through insurance, there are network considerations. Whether you're in network, out of network, the benefits work differently depending on how that works. I know I'm going kind of quick, so please throw questions up as you go if something needs a little more clarity. With VDPC and medical cost sharing, there's open enrollment. You can start any month you want. It starts on the 1st of any month. You just have to have that. You have to enroll by the 19th of the month for that to be active on the 1st of any month, but you can join any month. With traditional health insurance, you're subject to enrollment windows. So you can enroll during open enrollment, which is November 1st through December 15th, or you can enroll if you have a qualifying event like a marriage or a divorce, or you lose a job and you lose health benefits there, or something like that. Coincidentally, we are in an open enrollment period, kind of an unusual one because of the coronavirus. Open enrollment has been opened again for traditional health insurance through April 30th. So that's something to consider. If you need to get insurance, now would be a good time to do it. With the medical cost sharing strategy, your care plan for your ailments are determined by you and your doctor. Nobody is telling you what plan you or what recovery plan you need to get. That's decided between the patient and the doctor. Whereas we all know that insurance companies get pretty heavily involved when it starts coming to care. If you need a knee replacement or shoulder replacement, the insurance will have things that they want you to try first. Even if your doctor says, that's not going to work, I've seen it a million times, this is what you need. In many cases, the insurance company will not approve the surgery until you've done other things, or they simply won't approve it or make you jump through a lot of hoops to get it. Okay, here's an important one. In many cases, there's a lot of benefits to using VDPC and medical cost sharing. One of the major things to consider here is that there are some temporary restrictions on pre-existing conditions. We'll talk about the details I've devoted a slide to that entirely because it's an important thing to understand, but there are some restrictions on how they deal with pre-existing conditions. Those are temporary. We'll talk about those details. Whereas due to the ACA, there are no pre-existing conditions for traditional health insurance. So if you have a bum shoulder and you know that it needs surgery, you cannot join a medical cost sharing community and get that surgery tomorrow, knowing that you needed it for the past year. They won't provide funding for that. You'll have to either wait or get that done through insurance. We'll talk about those details, but you can join insurance today and get surgery next week on a shoulder if you pass all these other things if the insurance allows it. Okay, somebody asked about the ability of the community to cover expenses. So that's a good question. I should bring that up before people ask, because I get that question about half the time, which probably means that every time somebody thinks it and doesn't ask it. But the the pool for the big guns, the Sedera community that provides funding for the large medical expenses, has about 30,000 members nationwide. And even though we're setting this up and we're negotiating prices and joining it as a community of Colorado realtors, it is not just the Colorado realtors money that's available for Colorado realtors medical expenses. As soon as you join Sedera, the entire community of Sedera, the pool of money that belongs to the community, is available for any member that joins across the country. You have to be sponsored by a group to join Sedera, which is that's the role that CAR is playing here. But the 30,000 members that are putting money in monthly to the Sedera community, they all that money is available to any one of the members' medical needs. So it's a huge pool of money. Okay, hope that addressed that. Let's talk about, now that we know the difference from a high level, at least from the funding and administrative perspectives, let's talk about these resources for traditional insurance. If you go to this website, www.coloradorealtors.com/healthcare, you will see these two options. The website is designed to help you make a determination between these two options. And if you click on the resources for traditional health insurance, which I'll show you here, there we go. So if you click on this option to learn more about the traditional health insurance, it will take you to some resources and some language about updates on what we're doing with Colorado as far as association health plans are concerned. And we'll keep this updated with information as we get it. But if you want to view insurance options, you would click here. I've already gone through some of this just so you don't have to watch me do some data entry. But when you click on this, you will go here, which is a resource that Rita Lenz, our insurance specialist with Alpine, she's put this together for us to shop. I probably should have put in a Vail zip code. I didn't think about that when I got this ready, but I put in my zip code. I put myself in as a 55-year-old man with a spouse looking for a health plan. And these are the options that came up in my zip code. And then I can read a little bit about them. I can compare them. There's lots of things that you can do from this site. I think this is fairly familiar to most of you. You've probably seen something like this before. So I'm not going to go into much detail here, but some of these plans aren't available on the Colorado Exchange. The insurers don't put them there. And we have a resource to help realtors navigate this if you have specific questions. And it doesn't cost anything extra to do that. Okay, that's all I feel like I need to go into on the insurance side. If you'd like me to, somebody said it's a lot more expensive in Vail. I now that you say that, I feel kind of dumb for not putting a Vail zip code in there, but it is a lot more expensive up in Vail, whereas the prices for the medical cost sharing don't change based on your location, by the way. So anyway, the differences are still drastic even with a Denver zip code. The differences are still pretty drastic. I'll show you some comparisons when we go through the cost sharing. But those are the insurance-based options, or that's the resources we have available there. Pretty straightforward. There's a lot of nuance or a lot of resources there, but because I think you're probably familiar with them, I don't want to spend a lot of time on those. Okay, so let's talk about the medical cost sharing. This is, we're going to spend a little more time on this because I think it requires a little more explanation because it's a little bit new to many people. This comprehensive solution, we have gone away from using Apex combined with Sedera. People who are on that can still use it. In fact, you could even still enroll if you go to the enrollment site there. But we have made some, what we think are some major upgrades, including a reduction in cost, better primary care. This includes dental and vision plans as well. And they have a lot more robust care logistics to help people navigate the medical community in general. We'll talk about that. This comprehensive solution, although it's made up of these two components, I'm going to be talking about it sometimes like the two different components and sometimes like it's one cohesive benefit, because it really is very seamless when using these benefits together. These companies have a very strong and long-lasting working relationship, and they work very well together. So the benefits that you get here dovetail very well with Sedera. We'll talk about that. So sometimes I talk about it as one comprehensive solution or one benefit package, and sometimes I break out the benefits depending on who's providing them. But just know that it's made up of these two providers or these two groups providing one comprehensive solution for realtors, which is what we've worked on for you with CAR. Okay, so one of the main drivers behind Redirect's business model is that members have often complained that being involved with insurance can be confusing. It's a tough thing to navigate. Aside from just being able to afford it, it's also, if we've got 25 people on the call now, there's probably 10 people who have had experiences where, the doctor recommended they get a lab, or they referred over a specialist, or referred over this or that, only to learn later that that was out of network, or the insurance wasn't going to pay for it. And you get involved in managing all these things, not just the care that you need, but also paying for the care and whether something was covered, and just getting anything done can feel like you're in the middle of all these different groups that you're dealing with to try to resolve this, to make sure that your care is done properly and paid for. What Redirect did from the very beginning was say, hey, we've got really talented people that know how this industry works. Why don't we offer a concierge service? And this is the point of entry that I was talking about earlier. You have one number to call. It's Redirect, and they help you navigate all the different things that you need, including the billing, including how it gets paid for. So if you've got a kid with an upset stomach and it's not going away, or you're worried about it, you call them and they will reach out to the doctors in your area, find the ones that are available, that are open. They'll negotiate price, call you back in a few minutes and say, all right, we've got these three options. Here's where you can go. Here's how much they're going to ask you to pay. And we've already pre-negotiated. Go take care of it. Send us the results so that we can help. And that's only if they can't resolve it over the phone in the first place. 80% of the time, you can talk to a doctor over the phone, ask symptoms. They can look at your child. If this is, we're continuing with that example, look at them through a video conference and take care of it over the phone. But if it can't be taken care of over the phone, they can coordinate the care that you need in your area by using their I was going to say network, but I don't want to confuse that with the traditional insurance network, but just their network of professionals in the areas saying, all right, here's the care that they need. Here's what we're going to help you do. And you can even say, hey, I would like to see this doctor. I've got a relationship with this doctor, have for years. My kids know her, and they can call that doctor in advance and say, all right, Jenny, or whatever this person's name might be, we've got this need. She's going to come in. We want to take care of this quickly. And what can you offer if we pay right away, cash prices, or if she comes in with a check, what's that going to cost? And let's see how we can work that out. And then anything that rises above your what you've determined is a large medical cost, then Sedera gets involved and provides funding for that. But you're certainly welcome to call all of these people, but they've got a coach and a logistics team right there for your disposal. They can either do all of it for you, or they can help you through that. Whatever role you want them to play, they will help you coordinate all of those things and negotiate costs down and get those as efficiently and quickly as possible. It's a very nice service to try to keep you out of the middle of all the things that are unnecessarily complicated. This is just a chart that shows, this was updated, I think like a month ago. It's very recent anyway, but the calls let's go back to this slide. When the calls come into their care logistics team, this chart shows how they're handled. Almost 80% of them are handled without you having to go anywhere. It can be handled over the phone, which is awesome because anything here in this blue doesn't cost you anything. That's you can call the care logistics team, or the virtual direct primary care is what it's called when you talk to their doctors. That takes care of 80% of the calls. And then 12% of the time they send you to a primary care physician because you need to be touched or tested or whatever. It can't be done over the phone. About 8% of the time it goes to chiropractic or rehab. And then under 1% of the time they recommend you go to a hospital, or they coordinate care with a specialist in your area, or work through that with you. So most of the time it can be done without paying anything, which is a great way to enter the medical community when you need care. If we can deal with it without paying anything and do it from the comfort of our own home, great. Okay, questions about this? All right, I'm going to move on here. Redirect they also help you manage the prescriptions. So if a doctor, if we go back to this slide, if let's say this doctor provides a prescription, you can go to the pharmacy, or they can call around pharmacies. Again, if you haven't reached your large medical expense, you have prescription benefits, and they can help you maximize the benefits so that you pay as little as possible for the prescriptions and help you get that done. There's the prescription benefits here. Again, most drugs are a couple of bucks. There's a few that are more than that, depending on the availability and whether something's available in a generic or name brand. Well, and then there's a dental discount plan. This is included in all options that are available to you if you choose the cost sharing path from the website. Any option you choose there will include a dental discount plan and a vision discount plan. I'm not going to go through the details here. All these are available in the benefit summary, and I'll show you where that is when we go through the website again. But just know that you get some nice dental benefits and vision benefits when you enroll through the cost sharing option. Vision and dental options are available on the traditional insurance side as well, but they're not included. You would shop for those independently. Okay, I'm going to spend a little bit of time on Sedera. Many of you have seen this already, but this is when the expenses become large, and all of a sudden we're not paying cash rates, or we're not paying ourselves for. If let's say I choose my medium to large medical expenses to be defined as $500, and that's true, by the way. That's what I do. I use this exact plan. Anything above $500, Sedera would help me fund. I would be responsible for $500. Anything above and beyond that, Sedera would provide funding for. And we're going to talk about how that works. So when we enter the medical system, we call and we talk to the concierge team, and all of a sudden this is something that isn't a $200 solution. It's a $8,000 solution, or anything above $500 in my case. Then Sedera would get involved, and Redirect would also navigate that for me as well, help me use the Sedera benefits. So what makes the medical cost sharing work, specifically Sedera? We talk about most of these things just by way of talking about how all of this works, but I want to focus on two of these particular items. And the first one is that Sedera is a community that is about the people. I think of it kind of like a mutual company, or like a credit union, where the business or the community funds belong to the community, not the insurance company, or not Sedera in this case. So what Sedera does is they have guidelines which are legally binding, where they take 9.9% of the money that goes into the community to administer the technology, the platform, the accounting, the advocacy, the service, the people that are there on the phones to help out, to run their business. They take 9.9% of the monthly contributions, and that's it. They can't take any more. The pool belongs to the community. So there's a nice alignment of incentives there. Sedera is not incentivized to not help members who need medical bills paid for. They don't keep any of the money that doesn't go out to pay medical expenses. That's nice. That was an important thing for us when we were doing the due diligence on the different cost sharing options that are available out there. We've really had awesome success and awesome feedback from members who have been using Sedera. And then the other thing I'll go over here is that Sedera shares on a per need basis, rather than the annual deductible model and annual out-of-pocket model that traditional insurance companies use. We're going to talk about how that works. I got a couple slides devoted to that. So when they share on a per need basis, this is what that looks like. I'm going to use, in this example, I'm going to use my particular plan. I use this combination of benefits with a $500 IUA with Sedera. So if I'm up skiing in Vail in, say, over Christmas break in December, and I fall and I have a nasty leg break, there's going to be a lot of medical bills associated with that. Now, in this example, I'm talking about a leg break, but it could very easily apply to a cancer diagnosis, something that serious, or a stroke, or a broken back, or any illness or accident defines a need at the Sedera level, and then any of the bills associated with that would be considered all included in that one need. So it's one or more medical expenses caused by a single accident or illness. So if I fall and break my leg, and there's all these bills that add up, I've got ambulance bills, I've got the hospital, I've got the room, I've got the doctor, I've got the anesthesia, I've got the drugs, everything at the hospital, imaging, follow-up doctor visits and rehab, all those things, medical bills associated with that leg break, are considered one need. My responsibility for those medical expenses would be $500, because that's the IUA I chose. IUA stands for Initial Unshareable Amount. It's similar to a deductible, but it basically determines what I would need to pay before the community would provide funds for my medical expenses. And we'll talk about what options you have for IUAs that you would choose when you enroll. 500 is the lowest and 5,000 is the highest, but you determine what that is. Mine is 500. Anything over $500, Sedera community, the Sedera community would provide funds for. They also have a limit in their guidelines of how many times you would be responsible for your IUA. I don't want anyone to interpret this language here as limiting how many times you can access medical facilities. There's no limit on that. The limit is how many times I would pay my IUA. So if I'm a particularly clumsy person, but I'm still an adrenaline junkie, and I hurt myself all the time, and I have a particularly bad year where I break my leg skiing, I break my arm mountain climbing, I hang glide, and I race kayaks down the river or something, I don't know. But let's say I hurt myself a fourth time in a given year, I would not be responsible for my IUA the fourth time. I would only be responsible for my IUA 3 times. So I can kind of look at this as a maximum out of pocket that I would be responsible for major medical expenses of $1,500. Okay, because I would pay my IUA 3 times, and then if I had a fourth one, I would not be responsible for my IUA. Sedera would provide funding for all of the bills associated with my fourth need. Okay. Looks like I'm doing pretty good. I don't see a lot of questions popping up. I'm just going to move right along. All right. This is an important slide. This is the slide that talks about how the pre-existing condition limitations work. So first, let's talk about what is defined as a pre-existing condition. It's a condition. I should just read this. A condition is considered pre-existing if a member has had observable symptoms or received treatment within 36 months of their membership effective date. So if I joined, or if I enrolled today and my effective date was May 1st, then if I have any observable symptoms or received treatment within 36 months of May 1st, then that would be considered a pre-existing condition. Now, that doesn't mean that I can't get any help for that pre-existing condition. Remember, all the different benefits that Redirect provides, those have no restrictions on pre-existing conditions. So if I know that I have a bad back and I need to see a doctor about it once in a while and just keep an eye on it, they will still help me set those appointments. They'll still coordinate that. They will still help me get the care that I need. They'll help me negotiate costs, all that stuff. Even if it was a pre-existing condition, I still have access to the prescription benefits. Even for my back, there are no pre-existing limitations on any of the benefits except for expensive medical care. If I need treatment, if I need a back surgery and it was a pre-existing condition, then they will not provide funding for that back surgery within the first year at all. And in year 2, there's a $15,000 limit of what they will provide. In year 3, there's 30. Then after 3 years, there are no restrictions. So even if I join with a pre-existing condition, after the 3rd year, I could use the community funds to pay for medical care for my back if I needed it with no restrictions. All right. I want to make sure that this is very clearly understood, because this is probably the main point to understand to determine whether medical cost sharing is a good fit for you or your family, is how they deal with pre-existing conditions. This is also one of the reasons, by the way, that makes medical cost sharing significantly less expensive, because you can't join it today and get shoulder surgery tomorrow when you knew that you needed it when you joined. They don't pay for that kind of care, which helps bring the cost down for everybody. And I think we can all kind of understand that something like that needs to be in place for this to be sustainable and viable, and that's how they do it. Oh, there's one thing I will mention here also. There is a specific pre-existing condition that they have some language around to make it clear that if you take a medication for blood pressure or high cholesterol and you don't have any other symptoms or any other treatment in the last 36 months, so you haven't gone to the doctor for chest pain or anything like that, you're just taking a drug for those conditions, high blood pressure or cholesterol, they will not consider that a pre-existing condition. So if it's been under control and I haven't been to the hospital or haven't had symptoms or treatment within the last 36 months, but I take the drug and then in month 4, I have a heart attack, there would not be restrictions on that condition, on that, on those medical bills, because I was taking cholesterol medication or high blood pressure medication beforehand, as long as I didn't receive treatment or symptoms or had observable symptoms in the previous 3 years of joining. Okay. All right. Hopefully that's clear. That's an important point. I want to make sure everybody sees and understands that. Now let's talk about this. So I mentioned this a little bit in passing, but I want to emphasize it. So Redirect offers these benefits, helps you coordinate the care. A nice thing about Redirect is that they have thousands of members that also use Sedera, and the care logistics team is very familiar with Sedera. So when you're a member, when you enroll here, they will know what your Sedera benefits are. And if you go to the doctor, if they help you coordinate a doctor visit for something that you think is minor, but it it actually comes, it turns out to be something that isn't minor, and all of a sudden the medical bills start piling up. They know when to get Sedera involved and how to use your benefits with Sedera to pay for the care, so you don't have to end up coordinating that. You can stay out of that network or that web of taking care of that if you want to. I mean, you're welcome to get involved and call the different components. They're more than happy to talk to you, but they will also do it for you, which is really nice for people that are on the go and busy, and in this circumstance dealing with a medical issue that the last thing they need is something else on their plate to deal with, or bills that they don't understand. So Redirect knows how to incorporate Sedera, when to incorporate them, and how to use those benefits to get the care that you need. Okay, that's an awesome point. That this is one of the main reasons we chose Redirect, and we're replacing Apex with Redirect, because this relationship is very powerful. It helps make this a very simple benefit for you. Okay, I'm going to go. There's the pricing. This is something that everybody wants to see, of course. The way to read this really quickly, this top line here is if you only want the Redirect benefits, you do not want the Sedera benefits. So it's just the care coordination without Redirect. And if you had a heart attack or you had an expensive medical need, you would be responsible for paying those bills. Sedera would not get involved because you wouldn't be a member if this is how you enrolled up here. But some people do that. So if we have some people that use that because their spouse maybe has a plan through an employer, but it's a high deductible plan. And every time they go to the doctor, it costs $100 or 150 or whatever. And they want 24/7 access to direct primary care. And this is what that would cost to add that, depending on whether it's just one of you, or a couple, or one with children, or two with children. These are the costs for just that. And then if you want to add Sedera benefits, these are the most popular options. There are other IUAs you can get in between 500 and 5,000, but we just make it simple because these are by far the more popular ones, and you can kind of see what the cost would be just by looking at the sheet. It's going to be in between there for IUAs in between here. So these are broken out by age category, 18 to 29, 30 to 39, and so on. This is not available for people 65 or older, by the way. Medicare is so heavily subsidized, it's a pretty good deal. It just doesn't compete with that, so it's not available after 64. Let's see what else is there to note on this page. I think it's pretty straightforward. There's a $75 surcharge for tobacco users, by the way, just to compensate for the additional risk that adds. And I will note, I'm going to emphasize these two numbers because if you remember, when we did let's go back here, when we went through the traditional insurance option, the very least expensive plan for a couple age 55, which is the details that I put in, and this is a Denver zip code, so Vail might be 20 or 30% more than that, or maybe more. I should have looked that up. I apologize for not doing that in advance. But the cheapest plan, which would be the worst benefits, cost me $939 a month, whereas the very best plan, the most comprehensive solution here, would be $618. That would give me a $500 out-of-pocket cost if I had a heart attack. And then something that might be a little more comparable, a $5,000 IUA would be $400, less than half of that cost of the insurance plan. So you can see that the cost for cost sharing is significantly less and quite comprehensive if it's a good fit for your family. And the main determinant of that would be the pre-existing condition slide that we talked about. Okay, I hope everybody saw what they wanted to see here. I'll show you the website again and where to get these pricing, where to get this price sheet. You can just download it. And you can download all the other prices as well if you want to look at the prices for the other IUA options. But let's move on for the sake of just keeping this going. I've got, okay. Okay, so I am recording this. I'm going to send it out to Erica and she'll disperse it. But somebody asked if they can switch from a traditional plan over to this. And the answer is yes, because there's no open enrollment for this. You can join this any month as long as you enroll by the 19th of the previous month. So if you enroll by April 19th, then you can start on this May 1st. Okay, so I'm going to go through a couple of examples. I'm going to start with some pretty benign ones or simple ones, and I'm going to move into some that are a little more complicated just to see how the different options work, health insurance versus the cost sharing option that we're talking about here. Somebody asked if the redirect price, or the prices that we showed, are consistent regardless of location, and they are. So you would pay the same price in Vail as you would in Telluride, as you would in Grand Junction, as you would in Denver or Pueblo. The prices don't change across the state. Or across the country for that matter. We have some people that are on this plan who actually live in New Mexico, but close to the border, and work in like Durango, and the prices don't change there either. So, okay, let's run through these examples. So let's say I've got a traditional health insurance plan with a $5,000 deductible, and then a max out of pocket of, I think the one I did here was a $15,000 max out of pocket with a 2080. So a deductible of $5,000, a 2080 co-insurance up to a $15,000 max out of pocket. This is how that would work. The premium for this, of course, is much higher every month than the cost of this every month. So I'm laying the monthly cost aside and showing what the out-of-pocket cost would be should something happen. So with traditional insurance, if I need to go to the doctor, say for a sinus infection, or what I suspect is a sinus infection, the doctor visit's going to cost me maybe $35, a small copay for that. And then I buy the antibiotic. And in this example, it costs $5. It might be less than that, maybe $1 or $2. But again, difference between $1 and $5 for this example isn't really going to make or break anybody. But let's just say the antibiotic costs $5. I'm out of pocket $40 in addition to my monthly premium. With the cost sharing option, the sinus infection is something that can easily be taken care of through the virtual direct primary care. So it would definitely land in that blue part of the pie that we looked earlier, where this could be dealt with the doctors over the phone without any need to go see a doctor. And that doesn't cost anything. You can use that 24/7, 365, and there's no limits on how often you can call Redirect, talk to their doctors, or use their care logistics team. Then they will send a prescription over to the pharmacy of your choice. You'll go pick it up. Maybe it costs you $5. It's probably going to cost you less than that, but I'm just throwing a low single-digit number in there. But it's going to cost a few bucks. So your out-of-pocket cost through the insurance is $40. Through direct primary care, we didn't really invoke any benefits from Sedera because it was a very small expense. Cost me $5 there. Difference between 5 and 40, not a big deal. This isn't really, I think, why people buy insurance or get involved with medical cost sharing. They're not worried about this so much as they are some of the bigger ticket items. So we'll kick this up a notch and we'll move up to a sprained ankle. So you've got an insurance plan, you sprain your ankle, there's a $50 copay for urgent care, a $50 copay for an x-ray. And in this circumstance, the x-ray shows just a sprain, no breaks. You're out of pocket $100 and you're limping around for a while. Through the medical cost sharing, now if you remember the philosophical differences between health insurance and medical cost sharing is, hey, the small medical expenses, I can handle those on my own. That's not what I need help with. I need help with the bigger stuff. This would be considered one of those small things. Obviously, they cannot do an x-ray over the phone. However, I'm using, let's say you go to an urgent care here and you've called Redirect, they negotiate a fair price for you. You get in there for $150. They negotiate an x-ray for $75 and you're out of pocket $225. It's very likely, by the way, that you wouldn't need to go here. If you called Redirect, they would very likely ask you your symptoms, take a look at it through the video conference, and order the x-ray right there, so you wouldn't need to go to an urgent care. And then they would look at the x-ray for you, right? You wouldn't need to actually go to an urgent care. But I'm in this situation, I'm showing a circumstance where you might be out of pocket more for small medical expenses here than you would be through a traditional insurance plan, as long as you don't consider the monthly cost of the health insurance versus this option. But this might cost you $225, whereas this is only $100. But I could see a circumstance here where it really only costs you $75 because the x-ray could be ordered directly from your primary care doctor that you've talked with over the phone. This is a high average for an x-ray, by the way. Redirect's average for getting an x-ray done is about $40. And this one I specifically had Vail in mind when I put this number in the slide, because it is more expensive to get things done in Vail. It's one of the prices you pay to live in there. It's unfortunate. Okay, so I see Stephen threw an answer to a question up there in the chat box. Just remind everybody to take a look at that. Okay, so I'm going to go through this kind of a same example. Let's say you went to the doctor, you suspect that it could be a break or a sprain, and in this case it was just a sprain. But what if it isn't a sprain? The x-rays come back and they're not as rosy and you need surgery on your ankle. you need to talk to a specialist. There's a $50 copay for that. And then you need the surgery. And because the surgery costs a little bit more than your deductible, you've got to pay up to your deductible. And then you've got a 20% copay after you reach your deductible. Sorry, coinsurance is the term for that. And you're out of pocket for that broken ankle, $5,500. Now with the cost sharing solution, if you've chosen $500 as your IUA, which again is that term that determines what you consider a large cost to be, a large medical cost, then once you've spent $500 for the medical care for that particular need, you're done. So once my bills add up to $500, then the Sedera community provides funding for all the additional costs. So I'm only out of pocket $500 for the broken ankle instead of $5,500. Okay, I'm going to kick it up a notch again. Now let's talk about something invasive, takes a long time to deal with. You've got multiple doctor meetings, multiple imaging, surgery, maybe chemotherapy. We're going to talk about a cancer situation. So in a cancer situation, let's say in the first year, you've got several doctor visits, an MRI and some surgery, and you've hit your deductible. You haven't quite reached your max out of pocket, but once you hit your deductible, you're paying a 20% coinsurance and you're out of pocket the first year, $7,080. Whereas again, this is pretty simple on the cost sharing side. Once I hit my IUA, the $500, I'm done. I don't pay anything extra for the medical care that I need for that cancer diagnosis. So that's just year one. In year two, unfortunately with insurance plans, your deductible and your max out of pockets reset after December 31st. And you've got to start paying again for doctor visits, your copays. And then let's say now chemotherapy is needed, which is very expensive. And due to that, you do reach your max out of pocket. And so anything after that in that year, you're not required to pay because you've reached your max out of pocket. Oh, I see an error in this. This should only be $15,750 down here. Anyway, but you're out of pocket 15 and some change in the second year, plus the $7,000 you were out of pocket the year before, and you're out of pocket now, almost $23,000 for that cancer treatment over a 2-year period, which, you know, if it saved your life, that's a great deal. It still is a decent amount of money, especially in an industry where I'm guessing most people on this call are realtors. We do have some independent contractors like inspectors and things like that join these from time to time. But for the most part, you know, if you're battling cancer for a couple of years, that's probably going to impact your business as well. And in that case, not only would you be responsible for $22,000, but you would also probably be dealing with some lower income than you're used to due to dealing with a medical issue. Okay, so that's the health insurance side. Now on the cost sharing side, even in year two, the IUA does not reset because it was one cancer diagnosis. You're still dealing with it. It doesn't matter that it went from the calendar turned from December 31st to January 1st. There's no reset. You do not pay your IUA again for the same illness that you're battling. So all of the care that you need above the $500 that you paid the previous year is provided for by the Sedera community money. So you're still out of pocket after a 2-year period of time, $500 to deal with that cancer. Okay. Hope that's pretty straightforward. Let's go to, I'm going to show you how to get, going back to let's go back to this. This is the site that you go to when you go to that coloradorealtors.com/healthcare. And instead of going to the traditional insurance path, if you go down the cost sharing path, there's some resources here that explain and help you kind of decide whether cost sharing works for you. Here is the PDF that has the most popular pricing on it, the $500 and the $5,000 IUA, or just getting redirect alone without Sedera. That's available here. You can download that or just look at it here. And then if you would like to enroll or to learn more or to look at some of the legal documents that show you how the care works, those are called benefit summaries. Then you click on this and it takes you into this portal where you can enroll. The pricing is available here again. There's some other resources here that you can read about, but if you just pick my plan, let's say I want to cover myself and my spouse. Oldest of us is 50 years or 55 years old. We don't use tobacco. And then it's going to give me the prices. There's the price for just redirect. So no Sedera involved with that one. This is the price for the $5,000 IUA. This is the price for the $500 IUA, which we looked at earlier on that sheet where I circled the green numbers. These were the numbers in there. And you can look at the benefit summary, which is a very useful document. It shows you all the different benefits that are included when you enroll. And you can simply enroll. If you would like to get an IUA that isn't $5,000 or $500, there's a $1,000 option, a $1,500, and a $2,500 option as well. You can click here for the pricing on all of those options. I'll leave this here because some of you might be scouring this for some numbers that might fit your family. But if you want one of these numbers, you certainly can get it, but you'd have to call to get it. And that can be done over just a few minutes over the phone. You'd call this number, they would enroll you with the IUA that you would like. If you want one other than 500 or 5,000, those are the more popular ones. And we tried to keep the flow of the website a little simpler. So those are the ones that you enroll in online, or you can call and get some of these other ones by just over the phone. Okay, I'm gonna move past this. Hopefully everybody got what they wanted to see there. But then you would click here to enroll, and it's that simple. You put in your information, you put in, the family demographics, who you're looking to put on this plan, you and a spouse or dependents, what association you belong to, click Vail. I think we have some people from Telluride on this call as well. And then how you heard about it. We want to know, where our efforts are most effective, and you would enroll. Let's see, I don't know if there's anything to say beyond that. I think it's pretty straightforward. Anybody that's shopped at Amazon before has seen something like that. And I believe that is it for, let's go back to this. That's all I got. I'm going to stick around, throw questions up in the chat feature. I'll mute myself, but this is our contact information. If you have high-level questions like whether insurance or cost sharing would work, or you've got a circumstance that you'd like to run past us as to whether this would be considered a pre-existing condition or not, we can get you on the phone with Sedera. If it's real technical and you want something in writing from them, we've done that before. Yeah, if you have high-level resources, if you want some high-level resources or questions, please feel free to call us or email us. This is my contact information. So if you have an office that you think should hear this and you'd like to set up another webinar for a group, I'd be happy to do that. And then here is the enrollment page. And remember again to use the www before you go to CAR's website. All right, that's it. I'll stick around. I'm going to mute myself in case there are other questions. I saw one just popped up. I'll answer that real quick. But I'm going to stop the recording for now and make that available to Erica. You'll get that in the next day or two. And then that's all the information I got prepared. So